Welcome to Mindfulness of Feeling, exploring emotions through the body, a guided, trauma-informed meditation practice centered on emotions and the body. My name is Michael Gargano. I'm a licensed mental health counselor with diagnostic privilege in New York State, an EMDR practitioner, and a certified dialectical behavior therapy professional. In this practice, we will gently explore sensations in the body and emotions that may be present right now. The focus is on choice and safety. At any point, you are free to adjust, pause, or stop this practice. You are the expert on your own body and experiences. The goal is not to clear your mind or feel a certain way. The intention is simply to practice noticing with as much kindness, curiosity, and non-judgment as possible. Because everyone's nervous system is different, you are always in charge of how you participate in this practice. At any point, you can pause the meditation or shift away your attention from a difficult emotion. You may choose to look away or close your eyes, or perhaps shift your feeling to your feet on the floor or your breath. Or you might change your posture or stop this exercise altogether. Any of these choices are completely welcome and count as mindfulness. Before we begin, take a moment to notice your surroundings. Let your eyes rest on a few objects or things in the room with you. Notice shapes, colors, or sources of light. If it helps, you might identify one or two anchors in the space that you can return to with your eye or attention at any time if things feel overwhelming. You may choose a posture that feels supportive. Perhaps sitting upright with your back supported, feet on the floor, or lying down if that feels safer and more comfortable. You may keep your eyes closed, or if closing your eyes does not feel safe, you can soften your gaze and look down toward a spot on the floor. Now gently bringing some attention to the places where your body makes contact with support. Notice your feet touching the floor or the weight of your body being held by the chair or the surface beneath you. You might press your feet slightly into the floor or feel the support of your seat underneath your hips and back. If it feels okay, take a slow breath in through your nose and a longer, gentle breath out through the mouth, as if fogging up a mirror. We will do this 2 more times, but only if it feels comfortable. Take a slow, deep breath in through your nose and a longer, gentle breath out through the mouth, as if fogging up a mirror. Breathing in and a long, slow out breath. If at any time the breath feels uncomfortable or activating, you can let your breath be natural and instead focus on the feeling of your feet on the floor or your hands resting on your legs. We'll now scan the body with curiosity, not to change anything, but to notice what is already here. Remember, you can skip any area that feels too intense and move to another part of the body that feels more neutral or safe. When you're ready, let's begin with the hands. Notice where your hands are resting. Are they warm or cool? Heavy or light? You might gently wiggle your fingers or press the fingertips together to feel a bit more sensation if that feels okay. If not, simply notice your hands as they are. Now I invite your attention to your shoulders. Notice if they feel tense, relaxed, tight, or numb. There is no right or wrong way for them to feel. If it's helpful, you might slowly roll your shoulders a bit, or gently lift them towards your ears and let them drop, adjusting so you feel just a touch more supported. If you like, you can bring your attention to your face and jaw. Notice if the muscles around your eyes, your forehead, or your jaw are gripping or relaxed. You could try softening the jaw a little, maybe letting the teeth apart or relaxing the tongue in the mouth. If that doesn't feel good, you can move your awareness back to your hands or feet at any time. Now slowly shifting the center of your body, perhaps the chest, the area around your heart, or the belly. If it feels okay, you might rest a hand on your chest or abdomen as a way of offering gentle support to yourself. If that doesn't feel safe or comfortable, simply keep your hand wherever you feel most at ease. As you notice these areas, remember that you can always return to your anchor, your feet, your hands, or the contact with the chair, if any of these sensations becomes too much. You are free to move, stretch, open your eyes more fully, or shift your posture at any time. Now we'll explore emotions by not thinking about them as stories or memories, but by noticing how emotions might show up in the body as sensations. You might consider bringing your attention again to the chest and belly area, and asking yourself gently, what is here right now? Is there any emotion present, strong, subtle, or in between? You don't have to name the emotion perfectly. You might just notice qualities like heavy, tight, warm, fluttery, hollow, or neutral. Whatever you find is welcome, including not feeling much at all. If you notice a particular emotion, perhaps sadness, worry, anger, or something else, see if you can locate where you feel it most in your body. Perhaps it's in your throat, your chest, stomach, shoulders, or somewhere else. When you notice that area, you might say silently to yourself, "Yes, I feel it there," or "That is what sadness, worry, anger feels like in my body right now." You do not have to like the feeling or agree with it. You are simply acknowledging that it is present. As a reminder, if the sensation becomes too strong, you can imagine turning a volume dial down just a bit, allowing the sensation to be there, but softening how intensely you tune into it. You might widen your attention to include other parts of your body that feel more neutral or grounded, such as your feet or hands, or the points of contact with your chair. You can give yourself permission to take a break, open your eyes, look around the room, and reconnect with the safety of this space. Consider bringing a tone of kindness, gentleness, or curiosity to whatever you are feeling. If it helps, you can place a hand on your heart or another area that feels supportive, and silently say something like, "It's okay to feel what I feel. I'm doing the best I can in this moment." Or simply, "I'm here with you." Choose any phrase that feels gentle and believable, or skip this if it doesn't fit for you. As we begin to close this practice, let your attention expand again to include your whole body. Notice your posture, the weight of your body being supported, the temperature of air on your skin. Take a moment to notice if anything has shifted since we began. You might feel exactly the same, a little different, or not sure. All of this is completely okay. The intention here is not to fix or change anything, but to simply practice meeting your internal experience with awareness and as much kindness as is available. Now bring your attention back into the room. You might listen for sounds nearby or far away. Notice the light and the shadows in this space. Perhaps wiggle your fingers and toes, roll your shoulders, or stretch in any way that your body is asking for. If your eyes were closed, you can slowly begin blinking them open, letting light gradually in. Before we end, take a moment to acknowledge yourself for showing up for this practice today. Checking in with your body and emotions in this way is a skill, and every time you practice, you are strengthening your capacity to choose, to notice, and to care for yourself. When you feel ready, you can transition to whatever is next in your day, perhaps moving a bit more slowly and gently for the next few minutes. Thank you for joining us on this guided, trauma-informed meditation practice.